My colleagues, I think it's pretty clear that Obamacare's days are numbered. Either the Supreme Court will strike it down via rulings on cases like King versus Burwell or Colbeck versus Burwell. Either it will be repealed in 2017, or it will implode on itself, taking the health of many of our citizens with it. The annual price tag for Obamacare is about $1.35 trillion, all to ensure an additional 19 million citizens, while 36 million still remain without health insurance. That works out to about $71,000 and $71,052 per additional enrollee per year. Against this backdrop, a high-quality individual health plan could be purchased on the open market for less than $6,000 per year. It's time to think about life without Obamacare. If Obamacare were ever about care, it might be worth seeking ways to tweak the legislation. The stated objectives of Obamacare, after all, were to lower the cost of care, expand access to care, and protect consumer choice. In fact, the true objective was control, not care. It defies logic to assert that the addition of 159 new organizations between a patient and a doctor would lower the cost of care. It defies logic to assert that the insertion of bureaucrats between a doctor and patient would actually improve the quality of care. These new organizations and bureaucrats do come in handy, however, if your goal is control, not care. Why do you think the IRS was designated as the enforcement arm for Obamacare? For the sake of completeness, by the way, anyone who liked their insurance before Obamacare know the fallacy of the objective to protect consumer choice. So how do we really truly achieve the stated objectives of Obamacare? Well, I think we need to return to free market principles. If we truly want to lower costs and we want to improve the quality, we need less government involvement, not more. In practical terms, that means Michigan needs to remain steadfast in our opposition to a government-run, state-based exchange. These exchanges have the appearance of the free market, but behind the curtain are run by an army of bureaucrats accountable to the Federal Secretary of HHS, not the consumers on the exchange. Don't believe me? Read the HHS blueprint, the exchange regulatory blueprint. I have. So, we know what not to do. What should we do? I believe that we should implement what I call and what I refer to as patient-centered care solution. For routine care, remove the need for third-party payers. Refocus primary care on the doctor-patient relationship via direct primary care service contracts. Reserve insurance for catastrophic care. Health plans featuring direct primary care services for routine care and high-deductible insurance for catastrophic care have been proven to reduce employer-based health care costs by 20% and reduce hospitalization rates by 50%. In other words, we have lower costs and better care. But what about those who are still unable to afford access to quality health care? As it turns out, this patient-centered care solution would also lower costs and improve the quality of care for Medicaid enrollees. The state of Washington launched a pilot program of 1,000 enrollees and realized cost reductions of over 50% while also reducing hospitalization rates by 50%. They have since expanded the program to 50,000 enrollees. Michigan spends over $14 billion each year on coverage for 2.3 million of our 10 million citizens. A 50% reduction in Medicaid expenses could reduce the tax burden on the remaining 7.7 million citizens by as much as $7 billion. Since 40% of this figure comes in the form of state contributions, we have the opportunity to free up as much as $2.8 billion of state revenue for other priorities such as roads and that elusive objective of tax relief. President Reagan once opined in his Time for Choosing speech that the closest thing to eternal life on this earth is a government program. It is my hope that the prognosis for Obamacare is not so rosy. After all, Obamacare is about control, not care. We live in the land of the free and home of the brave, and it's about time that we acted like it and promote free market alternatives to Obamacare.